right, I have to tell you that I'm actually a Spartan by birth. I think I'm more worried about telling you that than telling them that I'm a Planned Parenthood supporter. But certainly I've spent my career here in Ann Arbor, and my heart is a Wolverine, and I'm thrilled that you have come out today to support us. Thank you for coming out. Thank goodness for the sun. I've been around Planned Parenthood more than 25 years, and this is, in the recent years, or the recent days, this is the biggest attack we have ever seen in my history. You know, it's interesting to me that the House of Representatives is taking this time to decide to attack Planned Parenthood and the women and families that we serve. When I heard that the House of Representatives had taken this vote to defund the Title X program, which allows women to get life-saving reproductive health care, I just had to shake my head. In the middle of the most severe economic downturn since the Great Depression, Congress decides to mount a vicious attack on women's health. I just don't get it. I don't understand what they're thinking. What in the name of heavens does that have to do with getting this nation back to work? Which, by the way, is what they said they were going to do when they all swept in last year. What does this have to do with jump-starting our economy? Mike Pence himself admitted that the defunding of Title X does nothing to help the budget. I don't know about you, but I'm here today this afternoon to tell our elected officials that we don't think they're attending to the business that we hope for them to attend. We didn't elect them to hurt Michigan and U.S. families. We hoped that they would enact things that would help families. So we want them to get back to business, get back to the business that we thought was going to be the right thing. We want them to get back to the business of making sure that the $317 million that's available for family planning continues. We want them to get back to the business to ensuring that the 28 health centers across Michigan that Planned Parenthood runs and supports can provide the quality, affordable, life-saving care that we all know women need. The vast majority, 97% of our services, our annual exams, breast exams, cervical cancer screenings, and sexually transmitted disease testing and treatment, prenatal care, and that is what we want to focus on. That is what is so vital. We want our representatives to get back to the business of understanding that every dollar that's spent on family planning services saves the state of Michigan $6.47. We want them to get back to fighting for affordable birth control, because we know that so many of our families are just one unplanned pregnancy away from complete economic disaster. Like Sarah said, I'm pretty sure that when Congress took this on, they didn't understand just exactly what sleeping tiger they were poking a stick at. All right! As Cecile Richards, our national leader, said at a recent rally, she wondered if Representative Mike Pence understood that they were going to give us 1 million new names of supporters, more than $1 million in contributions. Polls show the vast majority, nearly 70% of Americans, think that Planned Parenthood is worthy of the funding that we get from the government and that we use it appropriately. You know, we have people, I'm sure there are many in this crowd, that have never been politically active, and this was the thing that said, okay, that's enough. I'm going to stand up. Today, Michiganders are going to walk for choice all over the state and to support what we know we need, which is the life-saving health care that Mike Pence and his friends don't think anybody deserves. If the folks in Washington won't mind their business, we're going to help them. On April 7th, we're going to Washington. You think this is a sea of pink? We are going to storm the Hill, and as I was recently there lobbying one of the one of the representatives said, "Oh, pink, Planned Parenthood's in the house." We're going to get the attention of our legislators that have right now been hijacked by a very small, radical faction of the American society that doesn't think that people and families ought to know what's best for them and act in their own defense. We're going to raise money, we already are. We're going to raise our voices, and we are going to be heard. So I need you to join with us. I need you to stand up. I need you to tell Congress that you stand with Planned Parenthood. Raise your hand and say, "We stand with Planned Parenthood." 1 in 4 American women. Have used and relied on Planned Parenthood. We want you to get out your cell phones, people. This is 11. Holy crap. We want you to text "I stand" to 69866. Those numbers are around. And stand up and be counted. Thanks for coming out and enjoy the sunshine.
Thank you, Lori. All right. Let's get some motivation in the crowd. Come on. Okay, each day the nurses and doctors and other healthcare professionals are dedicated to meeting the healthcare needs of women and men at our health centers. If it weren't for our next speaker, we wouldn't have the ability to provide preventative healthcare services that we do, including life-saving cancer screenings, family planning, birth control, testing and treatment for sexually transmitted infections. Moira Tannenbaum is a certified nurse midwife and clinician for Planned Parenthood. Prior to her service at Planned Parenthood, she worked for 13 years in gynecological care in Monroe County. She's also a former high school teacher and the mother of 2 young adults, so she knows how important we are. She is here today to share her experience working with the patients who so desperately need our services. Please help me in recognizing Moira.
So much. It's a big honor for me to be here today. Can you all hear me? Yeah. Okay. I'm a certified nurse midwife, and I am proud to work at Planned Parenthood. And as my introducer said, I am also a wife, a mother of 2 young adults, and a former high school teacher. I have been there with young adults for years and years. And one reason I'm here today is because we have Saturday hours at Planned Parenthood. Half the other clinicians are at work right now seeing patients. Yeah. And I work at Planned Parenthood because I am dedicated to meeting the healthcare needs of women of all ages. This is what we do every day. Let me tell you a little bit about some patients I've seen recently at Planned Parenthood. I see women who want to learn about their birth control options so they can plan when they will be mothers. Just yesterday, I saw a girl born 17 years ago to a 15-year-old mother. This girl told me that she and her mother grew up together. 2 years ago, it was the mother who said, "I want you to get on birth control so you're not a mother at age 15. I want you to be able to plan when it is you will have children." Now this young woman is planning to join the military and serve our country. Planned Parenthood helps her to have this choice. And in fact, due to this girl's family history of certain health conditions, her birth control options were really limited. But my colleagues at Planned Parenthood worked with her to find something safe for her that met her needs. I see women who need affordable health care. A few weeks ago, I saw a woman in her 40s, a mother of 4, who'd been putting off care because she doesn't have health insurance. She works full-time as a waitress. In fact, it's usually more than full-time. Based on her symptoms and based on my exam findings, I was concerned she could have ovarian cancer. You probably know that's the most deadly of the women's cancers. Without Planned Parenthood's affordable and excellent care, this woman might never have gotten care. She might have ended up in an ER in months or years when it would have been too late. As you've all heard, 1 in 4 American women has visited a Planned Parenthood health center, myself included. I'm proud to be working for the same organization that cared for me when I needed excellent and affordable care. We see men as well. We educate men about preventing sexually transmitted infections, and we treat men when they get infections. Thank you, all of our men supporters. We also provide vasectomies, helping men have a choice about when they are done having children, and helping men take responsibility for contraception. 97% of the care I provide as a Planned Parenthood employee is preventative. I do breast exams. I love all those signs. Thank you all. And I educate about breast health. I follow up on abnormal Pap tests. I talk with my patients about bone health and menopause and other menopausal issues. Planned Parenthood even treats precancerous cervical cells. And we test for HIV, a disease that still affects far too many in our community and our state. At Planned Parenthood, our care saves lives, and our care also saves money because we provide health care based on our rigorously scrutinized, up-to-date, evidence-based protocols. We are right there with the CDC and other government agencies. This is what we provide each and every day, and we do it for thousands of women and men right here in Ann Arbor, throughout Michigan, and throughout the United States. In these difficult economic times, Planned Parenthood is the healthcare safety net, and we will not lose it. The health of the patients we care for should not be a political issue. Planned Parenthood has cared for women for 95 years, and we must ensure that we can continue to care for generations of people to come. Thank you so much for being here today. Go Ann Arbor and go blue.
Joined by. She's a woman who is a civic and community leader in both Washington, D.C. and right here in Michigan. Debbie Dingle is a recognized national advocate for women and children. She currently sits on numerous cultural, health, social services, and civic boards in both Michigan and D.C. Mrs. Dingle is also a national Democratic strategist, a member of the Democratic National Committee, and has chaired numerous political campaigns, so she is no stranger to things like this. And as you probably guessed, Mrs. Dingle is also married to Congressman John Dingle, someone who is a proud supporter of Planned Parenthood. Please help me in welcoming a strong advocate for women, children, families, and access to health care.